Good morning and welcome to Community Conversations. My name is Cathy Jordan and I am the chair for the Elmhurst Senior Commission. The Senior Commission provides information, advice, and advocacy to enhance the quality of life for adults in Elmhurst. We would like to thank Mayor Levin and the City Council for all of their support bringing this presentation to you today. And also, we would like to thank Comcast, making sure that you have that extra cup of coffee and you can see this presentation from the comfort of your home. We as a Senior Commission are offering community conversations so you can receive, as I said before, the information from the comfort of your home. We miss seeing you all, and we are hoping that depending upon health situations and the CDC requirements, that in the fall we'll be able to resume in-person presentations. So let's keep our fingers and toes crossed. Today, we will try to pretend that the City Hall chambers are packed with smiley faces, anticipating a wonderful educational program. Sit back and relax and have that second cup of coffee as we begin our new normal community conversation. But I have a little advertisement. I need to share with you that this would not be possible unless I had the help from our commissioners. So I would like to thank Heidi Forbush, Nina Yu, and Chris Hansen for today's presentation. You're only as good as the people that you work with, and I work with a great bunch of people. Today's program, Senior Services, provided by DuPage County, will be presented by Marina Vargas. Marina is the Information and Referral Specialist working at DuPage County Community Services for the past 14 years. She has over 30 years of experience in the non-for-profit sector. Marina is not only an AIRS certified community resource specialist, but also a certified senior health insurance program counselor, which is SHIP. I have to say this, we had a horrible time trying to get hold of a SHIP person to come and give a presentation. We actually had to import somebody from Springfield. So I'm so glad that we have someone here in DuPage that will be able to help our seniors. It's wonderful. So let's welcome Marina for our presentation.
Hello, I am Marina Vargas from DuPage County Community Services. Thank you everyone for being here today. And let's try to learn something and a lot of details about our programs from DuPage County Community Services and Senior Services. Let's start. So here we have the pathway to services. When a client calls DuPage County, they're going to be calling our main number, which is the best number that you can clip it to your refrigerator because it's going to give you a lot of resources. And from that, with our operators, they transfer to the intake and referral unit where I work, and I've been there for 14 years. We have all kind of information service provision. If you have a question, if you need resources, always please give us a call. We transfer through different departments. One of the most wanted departments probably is the treasurer because community want to save in taxes. Those are homeowners. We transfer and give resources about other agencies and other counties as much as we can give you the information and be resourceful in that area. Okay, so you may ask yourself, what is intake and referral? DuPage County has the central clearinghouse for social service information. They provide all individuals and no-cost information. So the best number that you can keep with yourself is our number, the 630-407-6500. Because anytime that you have questions, anytime that you need resources, always call the county. We're going to see here now what services we have in the intake and referral. We have the in-kind woods that some clients they need assistance with clothing, furniture, household items, and we also have vouchers for prescription eyeglasses to eligible clients. We can support the clients with information about Medicaid, Medicare, access to DuPage, and prescriptions assistance for all the income eligible clients. I'm going to talk about the energy assistance. That's one of the top 3 most wanted programs, which include LIHEAP, weatherization, and LIHWAP. The LIHEAP is the Low-Income Home Energy Assistance Program. It's based on household income of 30 days. It has to be under 200% of the federal poverty level. The LIHEAP assists directly with financial credit towards the accounts of CAMED, NICOR, and City of Naperville. And also has the reconnection assistance, so if your utility got disconnected, you can get probably some extra more funding. And the one that really helps our household is the furnace assistance for homeowners when the furnace has been broke or is not operating, and that covers from October 1st to March 31st. The other program is weatherization, that is, provides energy conservation measures to aid lowering the cost of the heating and cooling in the households. They may include sealing cracks, insulating walls, repairing and replacing the refrigerators, and covering windows. And the new one for this year is the LIWAP. The LIWAP is the Water Assistance Program, and it helps with water and wastewater. The household for the LIWAP, because they pay the bill, it has to be or disconnected or in danger to be disconnected, and the bill is a past due balance of $250 at least, okay? Now we're going to be talking about transportation. Transportation is also one of the top three. You may wonder what is the third one, but not yet. So transportation, we have through different sponsors in the whole county. So we work, DuPage County works with different organizations and pays and townships and municipalities to offer the transportation service. The Ride DuPage from DuPage County is for only riding the area of DuPage County and for medical transportation for clients that have no Medicaid. But we have the Senior Free Ride, and that is an awesome program. This year, we have been blessed to having more extra funding, so more seniors are being helped with that. You have to be 60 years old. You can give us a call, do a reservation, and to go any place in DuPage County, not necessarily medical. People use it to do chores, to go to the bank, to go to the store, you know, any place. So that's our Senior Free Ride. Then I'm going to talk about, talking about transportation, here it comes, the third most wanted. It's called Benefit Access Program. It's a program from the Illinois Department on Aging that helps seniors to lower the cost of the license plate sticker, and also give to persons with disabilities or not access to transportation the ride-free card. And that program is excellent. We do help and support our clients. When they give us a call, it's an online application. A lot of our clients, they don't have access to the computers, they don't feel comfortable with a computer, and that's what we do. We do the application for them, and then we send them the information. It's a wonderful, wonderful program. Now I'm gonna get a little bit more into the senior services. Specifically, we have options counseling. The options counseling is a long-term care options counseling service focused in consumers' education, and is often provided when an individual or a person is planning for a current experience like going to a long-term care, or they were victims of a big change in life like a car accident and the health change. So that's why we have a person we talk one-to-one is to try to guide and educate the person in the options that they have, and that's why we call them options counseling. And here is one of the most wonderful programs. It is called Medicare. It's the Medicare Senior Health Insurance Program. What happened with this is once you turn 65, you need to sign in for Medicare. Or if you are receiving disability after 2 years, you are going to get also Medicare. And we do have, it's a free service during the open enrollment that is start in October. Most of the people call us because they need to do a prescription comparison and to know if the plan that they have is the best that they can have, or they need to start shopping for a new one. And that's when we support them. We will never tell them what to buy, or this is the best, or we're going to charge you. No, because we are completely impartial, and that's why we have trained counselors working at the county. Okay, so now we're going to talk about Medicare. We have our CHIP counselors. Those are the senior health insurance programs where we have free insurance information for our clients. We are a sponsor for the Illinois Department on Aging, and what we do is educate the clients about the best options that they may have in a poll of different options with the Medicare.gov. We do the Part D comparison. We help our clients to know about their rights. You know, Medicare, once you turn 65, you're going to have to sign in for Medicare, at least Part A, and we talk about that later. Or you can, if you are receiving disability after 2 years, you're going to be in Medicare. Here it says, what is not covered by Medicare? So Medicare doesn't cover everything. One of the things that frustrate more our clients is because it doesn't cover eyeglasses and it doesn't cover hearing aids. But in the commercials, you're going to be able to see that more and more insurance in the Medicare Advantage are offering that option, because that's when we are elders, that's probably what we need a lot, and it's very costly. We have the long-term facilities are not covered by Medicare. That goes under Medicaid. Cosmetic surgery, acupuncture. We talked about already eyeglasses. But some plans can be covered by Medicare Advantage. To be enrolled in the Medicare, you have to be a U.S. citizen or have worked at least 5 years in the United States full-time. Most people are eligible to enroll in Medicare under their own work history, but they can also be enrolled with their husband history, because that happened the same thing with the Social Security. They don't have their own Social Security, but goes under the husband. Let's go and talk about a little bit Medicare and all those letters. So we have the Part A. Part A, when you are 65, you get it automatically from the Social Security. You get the Part B, but Part A goes automatically. You don't have to pay for Part A, but that is the part that is going to be covered the hospital. And you will have a deductible, but it covers by the hospital, the hospice care, and the deductible for this year is $1,556. The Part B, and this is the nice part, some people and more our elders keep working until very late, so you don't have to pay for Part B, because the Part B is the doctor. And it's going to cost, I think this year is $171 a month. You don't have to keep paying that if you have credible coverage from your own insurance that you have at work. So you need to notify the Social Security. I'm working, I have credible coverage. I just need the Part A, because sometimes the Part A becomes the insurance from work, comes the secondary payer, and the Part A, because it's the government, stays as the primary payer for the insurance. But the Part B, you don't have to pay if you have coverage. And I can see, in my experience, I can see more and more clients continue working until late in life when they're 70, and they save, because they have a good insurance from work. So they save a lot of money there. Now we have the prescription plan. So now we have Medicare Part A and B come from the federal government, so it's there. But the Part D, that is from insurance companies, and that's when you have to be more wise as a consumer and see which one is the best. Do not believe everything that you see on the TV. Do not open all the mail that you receive, because you get bombarded with mails and mails for a couple years before you turn 65. Until the end of your days, you're going to have that. So be very wise. That's why we are in DuPage County. Always give us a call. I got people that said, hey, I got this paper, and it's telling me I can get wonderful, I can get everything, and I have to pay zero. Well, you have to read the little letter. The small letter is very smart. So always give us a call. That's what CHIP counselors are for, so we can go over that. And every year is going to be an open enrollment, because that way you can check which one is the best plan. If the plan that you have for the year works good and it still offers the same prices and you're happy, then you keep it. No changes done. But then you are in one insurance and then you say, oh, no, for 2023 it's going to be different and this is better, then it's the time to change. And that's why we help you and supporting you doing that. With the Part D, you always have premium, deductibles, copayments, always all the insurance are there. And it's always very important to know if you have costly prescriptions, to know in what tier that prescription is, because tiers go like 1, 2, 3. You want to know, okay, this insurance have my prescription that is $1,000 a month in tier A, but this one have it in tier B or C. So you really want to know those expensive prescriptions, because the basic and generic prescriptions, that's pretty much not an issue. But we have many of our clients and many of us take very, very expensive prescriptions. That's why we really need to be very savvy about it. Then the supplemental plan, along with the Part D, that it comes from private insurance, the supplemental part also comes from private companies. Is A, B, and D, you need to have it. That's by law, otherwise you're going to be ending up pay for you're going to be paying for late fees and because you didn't enroll. So you're going to be paying penalties. So some people, I heard that, oh, I'm not sick. Why am I going to be paying for Part D? I don't need prescription plans. I don't take it. I can get it, if I ever get sick, which is wonderful. But if you get sick in the middle of the year, you have to wait until January of the following year to enroll in a prescription plan, and then you have to wait until March to be effective. And probably you're going to be coming out of your pocket with a lot of money. So, plus you're going to be paying fees. So you don't want to be doing that. So A, B, and D goes with that. Some people, they can afford it, and they said, you know what? I'm going to have a supplemental plan that is going to cover, I only pay one fee a month, and then I only have a deductible, and they cover the 20% that is not covered by Medicare. But they only cover things that are covered by Medicare. What is a good example? Cosmetic surgery. Oh, I'm going to have cosmetic surgery. I have a supplemental plan. My supplemental can pay that? No, it's not going to happen because Medicare doesn't pay for cosmetic surgery. And at the beginning, let me go back a little bit. With the Medicare, we have two ways to get Medicare: original Medicare and Medicare Advantage. So at this moment, everybody is different. Every person is different. For some people, original Medicare is a good option. And for other people, Medicare Advantage is the good option. The main difference between both of them is that with original Medicare, you can go any place, any doctor. All of them take Medicare because it's the government. They pay on time, it's okay. But with the Medicare Advantage, it's probably like the insurance that we have at work, which is HMO. So you have to be within your network, because if you get out of your network, you're going to be paying a lot of money. So you don't want to do that. And the Medicare Advantage includes everything, and that's what probably you see the Part C. Some people say, oh, what is Part C? It's the same Part D, but includes the doctors, includes the prescription, and that's what is the Part C. So that's basically some of the idea of Medicare. Every year, once you turn 65, you're going to get My Medicare and I. So it's a beautiful book that you want to keep it in your night table because you're going to be reading that for many years to come. Medicare is a very confusing, it's a very comprehensive program from the federal government, and that's why we have the CHIP counselors to try to answer. I always tell any of you, I will tell you, take one step at a time, because it's very hard to try to understand Medicare all at once. So if you just call us to an intake and referral unit and you said, I'm going to be 65, I need to know about Medicare, personally, I always tell you, this is the first thing that you need to do. And you go one by one from there. But like I go back. Lately, I see more people staying work later and try to save money in the Medicare so they keep their work insurance. And I always said, the first thing that you have to do is this. No worry, nothing about else. So we go in details because you'll be asking, how am I not going to pay the Medicare Part B if I have insurance from work? You have to talk to the Social Security office, and they will stop that. So that is, and it has to be under credible coverage, very important about Medicare. But in the future, this is a very brief information about Medicare. If you have questions, always give us a call. We have CHIP counselors. We take your information. We call you back. We make you an appointment. We see you face-to-face. We see you, we do it over the phone. We email you. We have a lot of resources. We can email it to you, and everything is free. We have government programs that help with the health care. So we have the Affordable Care Act. The health department now is working fully with all the population in our county to get them enrolled and to renew their insurance. That's when you are not a senior and you have to pay for your own insurance. But if you are very low income and have a family of low income, then the state of Illinois has Medicaid, and we help you. You need to schedule an appointment to apply for Medicare. We do that at the county in our intake and referral unit. Dual eligibility, you're going to say, oh, what is dual eligibility? Those are for low-income clients. The state of Illinois has what is called the MMI. That is a project is a program that covers dual eligible clients that are eligible for Medicare and Medicaid, and they coordinate the services. It's an excellent way for a client that is having a lot of health issues, have the state of Illinois coordinating health services for them. We have the Medicare Savings Program. Probably I can put this one as the foremost wanted. Medicare Savings Program pay for the Part B premium for low-income clients. So it's an excellent program. We help you also to apply for that. It goes through Medicaid. And the extra help is from Social Security. So now we have Medicare Savings Program from the state of Illinois helping with my premiums, and the extra help from Social Security. And I have to say they're very good. They always, you would get a mail if you are low income telling you you may be eligible for extra help, and they help pay with the co-insurance and co-payments and the prescription cost. So extra help, we do help to apply, but most of the time the Social Security does a great job informing their clients about that. Now we're going to talk about a little senior services community care program. This is an excellent program. It aims to keep clients at home longer. If that's what they want and that they can do. So it's an excellent program that helps seniors to stay in their home, and it covers in-home service, helps with the household tasks such as cleaning, doing the laundry, preparing the meals, errands, and the homemaker can also help with personal care like bathing and grooming and dressing. Part of that community care program that is subsidized by Medicaid is an adult day service. It's designed especially for older adults that cannot be by themselves all day home alone. And it's an excellent program that gives the opportunity to isolated seniors to socialize because they're going to be in a place, and it covers prescription supervision, recreational and therapeutic activities, and nutritional lunches. That's the community care program. The emergency home response, that's the little thing that you put in your neck, it's a 24-hour emergency for clients that are, they have safety needs and mobility limitations. And it's a great item for persons that have a risk of falling or they have a history of falling and they're by themselves, so they just can push the button. It is an excellent part. Part of our community care, and how do you apply for community care? Well, many seniors don't know that you just need to call DuPage County if you live in DuPage County, because the program is from the Illinois Department on Aging. So each county have a different administration. For us in DuPage County, it's us, DuPage County Senior Services. So you give us a call, we do an intake, we refer them to senior services, they get a screen, and they can determine for how many hours the client is eligible, and is going to have a person helping at home and helping the caregiver. Probably usually it's a family, it's a relative that is spending all the time, doesn't have the opportunity even to run their own errands. So having a caregiver at home is very helpful and important. Now we have this money management. So in service, it's part of the community care, so you have a case managers, because some seniors, they have difficulties having a personal budget or paying their own bills or keeping the bank recording. So we depend on volunteers. This program is wonderful because we have our volunteers that help the seniors, and they are trained volunteers. They specialize in training in how to help organization, your budget, paying the bills, and writing checks. So many of our seniors, they can get overwhelmed. I'm overwhelmed, so I cannot imagine being a little bit older, I would be super overwhelmed. So that's the money management. Great program. It's running with a lot of volunteers. And the home delivery meals. This is also wonderful. The meals are prepared by the Senior Citizens Council, and they are delivered by the Senior Citizens Council volunteers. So it has been specifically now in this time that was the pandemic, it was so helpful to have people that I cannot go out, but I can still get a nutritional meal. And for this year, it was nice because they come out. Usually we always have the low sodium and the low cholesterol meals, but now they're doing like the general diet, the diabetic, the vegetarian, and the puree meals. which is because every person with different health conditions is a different requirements. So that Senior Services Council really rock. What to do, just give us a call. It's a donation base. So the senior always have the opportunity to just make a donation. But also some seniors said, I don't need the county coming here, talking to me, having a case manager. They have the private pay option. So which is also nice because they can go, they get the delivery meals, but they have to pay out of their pocket, but they save their time with them. Case management because not everybody is ready to have one of those. Let's see here. This is our Caregiver Resources Center. That's pretty much for all of us, in the county. We have information for the caregivers. We have different programs, and the state of Illinois has been working with that and having different programs for the caregiver or the person who is taking care of a relative that is raising children, like 55 grandparents raising children or caregiver raising children. And we have, financially, we have assistance with incontinence supplies or utility bills. We go to HIP or school clothing. So it's very important for grandparents and caregivers that they're taking care of the seniors or the children to use that program. The respite is essential for clients that they're at home, they need a break. I'm going to go on vacation, for a few days or for a week. How I'm going to do, how I can keep, my mom safe, the person they're taking care. So that's what is the respite. We have a limited financial assistance for that. Just always give us a call. We take the information. We need to know what dates you're going to need some coverage. And even if it's not days, it's like, probably I just need an hour a day. So it's limited. It's not forever, but every year you can reapply for that grant. And we also have information and legal resources to refer for the guardianship or for the divorce or for preparing of the will and the power of attorney, which is pretty much in our senior population always asking how do I apply and how do I get the power of attorney. We have now the choices care. So if a person is going to a long-term care facility, it needs to be a screen, and that's by law. But it has been a recent change. So if a senior and the relatives get a facility, they don't have to give us a call necessarily for the screening of choices. Now the facility are doing themselves. There's a lot of changes in this program. Actually, I got an email this week, and I haven't had the opportunity to read about the new changes in this. But the most important thing to know is if an agency tells you, oh, you have to have a screening before be admitted into the facility, give us a call. We give you an orientation and an answer on how we can proceed with that. The Adult Protective Services. We have a lot. This is very personal for me because I'm on the phone during the day, and it really touches you when a lot of people is looking for some answer, some protection. It's a lot of our seniors are abused, and abuse not necessarily is physical or verbal. It can be neglecting the senior, leave them in a place, and don't take care of them. So that is a very, very touchy. The case managers investigate reports of mistreatment and provide intervention in all the seniors 60 years and older, or persons receiving disability from 18 to 59 years old. And like I said, the Adult Protective Services, it covers because we got financial exploitation. That's a big one. And the state of Illinois has a program that has been running along with the banks. So they have been educating the people in the bank to recognize if a senior may be a victim of financial exploitation. Because, a senior, you go there. I remember my grandpa always go to the same teller, to the same bank at the same time, doing the same thing. My husband is a senior. He does the same thing. He knows the people. If one day you're saying, oh yeah, no, I need to take all my, all my bank, all my money, I'm going to close the account, that's a big trigger that what is happening, why this person is doing that. And it's a lot of other information about financial exploitation. Emotional abuse, the verbal abuse, the harassment, the humiliation about our seniors, the passive neglect, which is like this is only one dinner, it was only one apple for the day, that's it. So it's not even, that's the passive neglect. Sexual abuse, of course, confinement is like you're going to be in this room and you're going to stay there and you cannot get out of there. That's probably one of the scenarios I have heard before. And so always keep an eye on your neighbors, keep an eye even in your relatives, because you never know what is happening in somebody else's home. But if you see something different, and it doesn't have to be a black eye, no, even the way that you dress, if you see this person has not been bathing, or is not dressing, or is losing weight, or is gaining weight. So those are gaining weight, like like you suspect something is going on, like probably the person is, it's a lot of details about the abuse and the neglect. But always keep an eye, and always give us a call. We are confidential, we take the information, you don't have to give your name, we take a report, and we try to do an investigation and follow up with that senior that must be in a danger situation. The self-neglect. The self-neglect is also, because if you see that the person is, I don't want to eat, I'm not cooking, I'm not doing my laundry, and it covers like it says here, the hoarding, the lack of food. Then you see the newspaper has been there and accumulating, you don't know what is happening, but the person doesn't know, like, it lives by themselves most of the time, and it doesn't mean that he wants to go or she wants to go someplace and say, I'm abused. No, you are self-neglecting. You refuse to take your medication, to go to the doctor, to have a basic health care, and you have concerns about that person. We take the report, and we have the specialists that they do some follow-ups and investigation and try to support the client, because our seniors, some of them, they feel the pride that I work on my life, I don't need help. I don't need to ask for help. I don't need to go and tell nobody my life. And that is very respectful, but to let them know that it's somebody that they can talk, and it's confidential and it's private, and that's what we do, like at DuPage County. I also want to say that in our DuPage County, we have an ombudsman program. The ombudsman is the one that takes care of the reports for the seniors that are in the facilities. And they want to be sure that the senior is having a good care in those facilities. For last, probably just getting to the end, I want to say that we always look for volunteers, because as I mentioned before, we have the money management program. The ombudsman is also run by volunteers. Our SHIP counselors, the more SHIP counselors trained that we have, the better, right? The home delivery meals with the Senior Citizens Council. And we have our line, always give us a call. We have a program for a division for volunteers in our DuPage County. So it's called the Give in DuPage. So you're going to Give in DuPage, you can sign up to be a volunteer in any program. And not only with us, because everybody has a different, heart for some specific, like the food pantries or the kids or the children. So it's a different thing. So it's a great way to do an impact in our community. I think I'm done for today. I'm so happy. Thank you, everyone, for being here. Thank you for listening. And I'm going to say it again, the best thing I can say. DuPage County number 630-407-6500. Give us a call. We are there to help you. Thank you.
Thank you to Marina for all the wonderful information that she has provided for our seniors. DuPage County is chock full of tons of resources, so make sure you utilize them. I always end the program with a quote. The beauty of life does not depend on how happy you are, but on how happy others can be because of you. Make sure you try and make everyone happy, including yourself. Thank you for attending Community Conversations. We'll see you in the fall.